guys, I'm Allie, and you're watching Allie Answers. If you have an interest in health science and want some more detailed information on the topics I cover here on Allie Answers, be sure to check out my website at allie-answers.com. You can also contact me on my website to ask any questions you might have about COVID-19 or other infectious disease topics. I like to dig through the primary literature so you don't have to. Today's topic is multisystem inflammatory syndrome in children, an alternate type of illness that can present after a COVID-19 infection, occurring only in pediatric patients. Although it's a relatively rare condition, it has a pretty shocking clinical presentation and a significant mortality rate, with over 30 children having died in the United States as a result. Nearly all of these children pass away from heart failure, and these are children with a median age of only 8 years old. So, what does a case of MIS-C look like? Well, MIS-C has a symptoms checklist that's pretty remarkable because it requires a positive COVID test or a positive COVID antibody test to diagnose it. It has to reflect that the child at some point was either exposed to or infected by the SARS-CoV-2 virus. So when a child presents with MIS-C, they always have a persisting fever of more than 3 days long. And they'll also have a couple of these symptoms that indicate systemic inflammation. They'll have rash or conjunctivitis in both eyes, inflammation of the skin and membranes, low blood pressure or shock. Very dangerously, they'll have features of cardiovascular dysfunction as a result of this systemic inflammation, an impairment of clotting ability, diarrhea, vomiting, or abdominal pain. And finally, to diagnose MIS-C definitively, the child will show a couple different types of inflammatory markers in the blood. The most unfortunate aspect of MIS-C is that when the first cases of COVID-19 were hitting the US, the silver lining of it all seemed to be that kids were spared from severe and fatal outcomes of COVID. So it's really unfortunate to see that disproved by a condition like this that's exclusive to pediatrics, and it's a sobering reminder that kids still need to be cautious about their exposures. Unfortunately as well, the underlying cause of MIS-C is still mysterious, and hopefully in the future the causes of this rare and potentially fatal condition will come to the surface as more research is conducted. The mortality rate of MIS-C is about 30% higher than COVID-19 itself in children, reflecting the fact that only about 0.5% of pediatric COVID cases in the US are fatal, as reported by Johns Hopkins. It's important to note, though, that mortality varies widely by country. Thank you so much for watching this episode of Allie Answers, and I sincerely hope that you are staying safe and healthy where you are. I'll include a link in the description to the full article detailing a little bit more about multisystem inflammatory syndrome in children, and how there's also a condition that mirrors it that occurs much more rarely in adults. Please click on that link if you're interested in learning more about MIS-C.